Okay. Buenos días y bienvenidos a todos a nuestro webinario Industria Farmacéutica.
Good morning. Welcome to our webinar, Pharmaceutical Industry, a tale of growth. I'm the Executive Director of FIPHARMA, and I'm very proud to be here and share with you today the outcomes of a study that we carried out with the IQVIA Institute and hold some very interesting conversations with a group of panelists, some industry colleagues that will be here with us today for the next hour and a half. So first things first, the webinar will be held mainly in Spanish. Some moments will be in English, but for whomever may be interested, if you look at the bottom of your screen, you may find a globe icon that says interpretation, and there you can choose your selected language. There's simultaneous interpreting to English, French, and Spanish, and Portuguese. So please listen in at your most convenience. And today we're going to start with Davo, and then we're going to have Mauricio Cifuentes from IQVIA giving us some details on the outcomes of this study. And then we will move on to a panel where we have Eva Maria Ruiz Andres Seiter with Mauricio to answer some questions that will be receiving through the chat or the audience. And then we'll be having some closing arguments or conclusions. So I'm very excited to have you all today. And I would like to hand the floor to Florencia Lavel. And she's chair of FIPHARMA and a great example of female leadership in the pharmaceutical industry in the region. Thank you, Rafael. Thank you all attendees very much for your participation in this event. From FIPHARMA, we want to drive these spaces where we can present, analyze, and discuss all matters that are truly important and key for the healthcare agenda. I want to especially acknowledge those people who are behind this great project, the team we have at FIPHARMA, Valiant Access, and all the staff at CISARMA that made it possible to hold this event today. It is such an important time today because we're going to disseminate the results of IQVIA. This is a study that is conducted for the first time in Latin America region, where we analyze the impact of the pharmaceutical sector as regards the economic and social settings. We know that the pharmaceutical industry is generating a great impact with respect to research and development and changing the course of different diseases. And we've seen that, we continue to see that with the pandemic effect. From the FIPHARMA side, what we seek is to generate sustainable health systems. We know and we're aware of the fact that for this, it is key to be based on our key pillars, one of which is science and innovation. The second is a focus on our patients. And the third one is to drive alliances and collaborative work with our main stakeholders of the health system and accompany them and being able to propose and create innovative solutions that have a high impact for our patients in the region. And for that, it is also worth highlighting the impact of innovation. Innovation brings in tangible results for our economic system, for our countries, and for the region as a whole. And on this, we are greatly focused on innovation, bringing in innovation earlier so that more patients may have access to therapy that change the course of their disease, their health, and their lives. With this, I want to call for reflection. Today, I think this is a special time for us beyond being able to discuss the results of the study. We can talk about what our role is and what is our responsibility in achieving together a sustainable and equitable health system so that more patients in our region can gain access to treatment. In that sense, I will once again hand the floor and invite you with Rafael to continue this discussion and to enrich this space for such a productive space for dialogue and discussion. Thank you, Rafael. Thank you, Florencia. Always thank you for your support as FIPHARMA chair. Let us delve into the gist of the matter today. And for that, I would like to introduce Mauricio Cifuentes is principal of consulting services Andean region for IQVA and one of the driving engines behind the creation of this study. He will be sharing some of the particulars of the main issues that the study has delved into, and then we will continue with a panel where we will have Mauricio together with some other experts from the region, always in line with what Florencia was saying, that in FIFARMA, we love to create settings for discussion, always trying to find sustainable solutions and the best results for our patients. So with that, Mauricio, you have the floor and welcome to this webinar. Thank you, Rafael, and good morning, everyone. Rafael, can you confirm that you can all see my screen? Yes, we can see perfectly. It's a great pleasure. As Rafael mentioned, the idea would be to share the conclusions of the study carried out by IQVA on the impact of the pharmaceutical industry, research and development in Latin America, wherein we developed several topics that we will be going through in this agenda. So its objectives and methodology, then the main findings in terms of the economic impact and the social and human impact of the pharmaceutical industry in general, and research and development in the region, and the areas to increase the value of the pharmaceutical industry in the LATAM region. To start with the objectives and methodology of the study, the objective and our search is to provide a comprehensive perspective of the impact of the research and development of the pharmaceutical industry in Latin America through three dimensions, mainly economic value, the contribution to economic activity, measured by the main economic indicators to measure the impact of an industry for a country, social value, and this component is very important in terms of the benefits of innovative medications in the region, both for patients and for health systems and society in general. And finally, human value in terms of the benefits of these innovative medications from the patient's perspective. And based on this analysis and different components, identification of the priority areas to increase the value of innovative medications in Latin countries based on this impact. And the countries that were considered within the study, that include Argentina, Brazil, Chile, Colombia, Ecuador, Mexico, Panama, and Peru. And all these countries based on available information in terms of statistics, in terms of the country's economic conditions, and information on the impact of the pharmaceutical industry. So we conducted the analysis of these elements and the dimensions of the study. To conduct this study, in terms of the methodology, we used secondary sources of information, interviews to industry executives, and patient interviews. Within our research with secondary sources, we took into account figures published by the departments of statistics of each of the countries, specialized publications from multilateral organisms such as the World Bank, and priorly available IQVA VIA studies and sources of information from our company. In addition, within the interviews to industry executives, we interviewed 2 executives from pharmaceutical companies of the research and development industries, where we addressed topics such as investment on research and development, one of the topics of the key topics of the industry, some other issues such as human capital, patient support programs, sustainability initiatives of companies in the region. All of this around this conversation and around the inputs of information that these 2 executives provided us with to understand these dynamics of the pharmaceutical industry, to understand the characteristics of its operation in the countries of the region. And finally, we conducted interviews with patients with 2 pathologies, breast cancer and rheumatoid arthritis, which are highly prevalent in the region. And these are pathologies that allow to illustrate what is the actual patient's experience with respect to the reaction to the symptoms and the diagnosis of the disease, and the alternative offered by innovative treatment considering life expectancy and quality aspects, which is one of the key elements in terms of the social and human impact of the pharmaceutical impact towards the patients. So based on this information, the analysis includes contribution of innovative medications and contributions to the life quality of people, the evaluation of dynamics that call for a different response from the industry on factors such as the increasing life expectancy or the aging of the population or the increase of prevalence of high-cost chronic disease, the greater population density in urban centers. This is a characteristic of Latin America. Latin America is among the regions of the world with greater concentration in our urban centers, and therefore these characteristics of sedentarism and or the consumption habits and life habits make for a greater prevalence of chronic diseases, and therefore for the region it is essential to have an innovative response from the pharmaceutical industry to these concerns. In addition, these dynamics of new treatments with increasing price of medications for the health system call for innovative financing models and raising the standards on healthcare. And finally, the role of the pharmaceutical industry in these dynamics and its impact for the benefit of society, of people, of patients, and understanding how these dynamics drive not only individual patient benefits, but also benefits for their families, who are the next persons who suffer from a disease, and then there's society and the impact of these high-cost diseases and the alternatives offered by innovative treatment to improve these impacts, to mitigate these impacts. So to go into the actual contents and conclusions of the study, I will first be sharing the findings in terms of economic impact. When we analyze economic impact, we use two indicators, and these indicators are, on the one hand, the added value of a product within the economy. It is measured, as you can see, from its direct impact, but also the indirect impact caused by the industry with respect to the goods and services that this industry demands from other industries. In the case of the pharmaceutical industry, that's suppliers of raw materials, all logistics aspects, inputs for packaging of medications, and in general, all the economic dynamics that emerge from this industry as a indirect impact, and the direct impact understood as the expenditure, and the indirect impact as the expenditure of these employees of this industry in Colombia. Among the direct impacts of the pharmaceutical industry for the economy, we have $21,000 million in the case of Latin America, and in the case, and 16 additional billion dollars of which makes for around $37,000 million. That means that for each dollar that the pharmaceutical industry generates, 75 additional cents are produced in the Latin American industry. And on the other hand, there's the impact of employment, which is relevant in our countries in terms of the life quality of people. In the case of the pharmaceutical industry, Latin America generates over 250,000 direct job positions. And for each of these jobs, there is 1.65 additional jobs generated. That means that other industries generate 417,000 jobs for a total impact of the pharmaceutical industry in terms of jobs of around 670,000 job positions. In terms of the comparison of the evolution of the pharmaceutical industry with respect to other industries, we've selected several manufacturing industries and innovation industries. In the case of telecommunications, which is an industry of much innovation, particularly in the recent years. We've all seen its impacts probably. And with all these issues of virtuality, which have become like accelerated and have accelerated the innovation impacts in our lives. Two consumption industries, some of the key drivers of the GDP of countries, such as our beverages and clothing, and within the framework of these industries and their contribution to the gross added value and employment from the contribution of the pharmaceutical industry. In the case of the pharmaceutical industry, its contribution to the gross added value in Latin America, it's 0.7%, and that is the most highly contributing in this line item. That would be the telecommunications industry. And in the case of contribution to employment, it is the clothing industry or the garments industry that has a greater contribution to employment, whereas the pharmaceutical industry is contributing to 0.2% of the total job positions in the region. As we were seeing in the previous slide, it is not the pharmaceutical industry that has a greater contribution in terms of gross added value to the economy, nor in terms of employment, but there's something worth pointing out, which is that the pharmaceutical industry has a contribution in terms of employment because of the value of the job positions in the pharmaceutical industry, which is pretty much higher as compared to other industries. So it is one of the best paid industries for employees within manufacturing sector industries, and this in terms of welfare for families has a fundamental component, because in general terms, higher salaries entail higher consumption. And as I was just mentioning, it is one of the biggest generators of consumption for a GDP in countries. In Latin America, it is estimated that this consumption contribution to the GDP is approximately of the 70%, and in individual terms of the people, it's a better quality of life, a higher capacity for savings, and greater social mobility. Social mobility is also fundamental in the case of Latin American countries, both in the case of workers as well as for their families. For as we know, this is a region where close to 25% of the population is considered poor. Another area of impact, which is highly relevant in terms of the health industry, is the impact of investment in clinical studies. For 2019, the industry invested over $1 billion, benefiting patients who are receiving innovative treatment and achieving positive impact for health systems in terms of cost reduction, since innovative treatment reduces the complications of disease for patients. In this case, a lower cost of care of these patients in the health system. In addition, clinical studies or assays have also an economic impact, because there are a high number of professionals who are employed on this, and for the capacities and infrastructures required for conducting these clinical studies, as well as the hospital and laboratory network that makes up the industry. In the last few years, Latin America has seen over 7,000 clinical studies, this being the highest rate of clinical studies of the R&D industry in the region. And specifically for 2019, there were over 600 clinical studies conducted. Foreign investment is also quite relevant, and that in terms of a production capacity, which is intensive and which positively impacts employment, knowledge generation, the strengthening of the medication supply chain, which we were able to see during the pandemic, is key to respond to emergency situations such as arose with the COVID-19, and the technology transfer, which is also fundamental for the development of the parties. Between 2017 and 19, the industry invested around $95 million in 15 plants in the region, as well as in other technology solutions in some countries, as we can see in the example, such as Mexico, Colombia, Brazil, and Argentina. Now, in terms of the social and human impact, this is one of the most highly relevant areas. We have, firstly, the differential impact of the R&D of pharmaceutical industry, of the companies from the pharmaceutical industries. Several of them are recognized by the top employers in Institute as a great place to work, as among the best employers globally and in Latin America. And this recognition is due mainly to the commitment of the industry with the Sustainable Development Goals of the United Nations. This is one of the things that we were able to see with the executives that we interviewed, what they were telling us about what they're doing in terms of corporate social responsibility. They told us about sustainability and some of the things they shared in terms of the benefits for their employees. In addition, these policies are aligned with the welfare standards of the World Health Organization and diversity and inclusion policies, which are also cross-cutting issues for Latin America. In terms of the benefits, there is a myriad of benefits, but we would like to highlight some of those that very well aligned to the Sustainable Development Goals of the United Nations and the World Health Organization standards. Benefits for mental and physical health, such as complementary health plans or training on welfare. Another very high impact topic is particularly family welfare, allowing employees to have certain flexibility of time for their children, or breastfeeding rooms for mothers, shorter working days, and other benefits for the health of our collaborators. And finally, there's investment in education, which gives for more committed and better employees for the companies, which is seen in the turnover standards of the industry, where the employees' remaining time is around 3 years, but also benefits for the close relatives of the worker, which gives for greater social mobility. And this social mobility is key in the case of Latin America in terms of what we're seeing with respect to the high poverty rates. And when this helps people leave poverty, and this in terms of its economic impact and the individual growth within the region and its countries. In that same vein, as I was just saying, companies from this industry are at the forefront with respect to diversity, inclusion, and gender policies or approaches. One of the points worth highlighting is that not only working groups are created for the people who are part of this community, such as LGBTI or Afro-descendant war veterans, but those people who are part of leadership positions in the companies are oftentimes part of these minority groups. And there's also the politics on gender, such as equality for maternity and paternity licenses, contracting equality, and this reflects into a greater participation of women in the industry, with a 57% average in the industry. In addition, investment in sustainability and corporate social responsibility, and as I was saying, the commitment to the development goals of the United Nations, on the one hand, with health prevention and promotion programs using the capabilities of the industry aligned with health and welfare goals within the Sustainable Development Goals, and with the 10 principles of sustainability, of corporate sustainability of the World Health Organization. Also with environmental sustainability and impact programs, including initiatives to reduce pollution, to reduce the impact of operation and the production of the industry on environmental issues, and the development of competencies for vulnerable groups and communities. And finally, with initiatives and donations to face emergencies, such as is the case of the pandemic, COVID-19 pandemic. And the study has identified that during this pandemic, over $50 million have been destined for attending to it and for attending to the communities, not only through the direct contribution of the industry, but also through the motivation and offering platforms for our employees to give voluntary donations to these communities and to promote this sense of ownership and solidarity. Next, one of the areas of higher impact, and in terms of the impact of the life quality for patients, thanks to the treatment with innovative medications, we selected 2 high-impact pathologies in terms of the life quality and prevalence, as well as costs for the health system. First is rheumatoid arthritis, suffered by around 6 million people in Latin American countries, and breast cancer, causing over 100,000 deaths per year. These 2 pathologies have a very significant contribution from the pharmaceutical industry, as well as from many others, with innovations that have revolutionized treatment in the last few years, improving life expectancy, survival rates, and the life quality of patients under productivity. This improvement, in the case of rheumatoid arthritis, we can see in the lower severity of the symptoms, as we can see with the ACR20 rate, which has shown this impact or lower pain in patients that suffer this illness. In the case of both conditions, they have more time to share with their relatives, improved productivity, even improving the people's ability to return to their economic and productive work. And in the case of breast cancer, 76% of event-free years with respect to 56% on conventional treatment, 71 versus 56. So this not only impacts the actual lives and experiences and sensations of the patients, but also those of their families and caretakers, which are the groups that are next in impact from the diseases suffered by their loved ones. In addition, there are the patient support programs that support the achievement of the expected results. This through follow-up of the correct administration of the right dosage and strengthening patient adherence to treatment, which entails better results for the patients, better patient outcomes in terms of their indicators, but also contributing to cost reduction for healthcare system. And finally, to close this chapter, the study explores the impact of vaccines in life quality. And first, we must mention the prevention of 6 million deaths per year, huge prevention of deaths of children and adults, and the savings of millions of dollars in treatment of high complexity diseases. But in addition, something that we're very clear about from the pandemic after the COVID, which is the impact that we've seen in returning to economic activity, to normal life, to in-person schools, and with such an impact on our children, and accelerating the dynamics of economic recovery, particularly in our countries that have been the most affected because of the poverty and equity or equality and gender impacts, which are topics that we had been dealing with and we had been improving our indicators on in the region. And vaccination gives Latin America the possibility of going back on track with this path that it was going. And finally, in our final chapter, the areas to improve the value of the pharmaceutical industry. This is a process of development where we see that there are still opportunities, first for investment and development, investment on research and development. As we've seen, this is key to improve the added value of the industry, and it requires investments on things such as clinical research, digital transformation, and integration with academia, as well as access to health services, a plan with public and private sectors. And as we were mentioning, it is important to develop innovative financing models that allow to facilitate the universal coverage and ensure simplified and expedited regulatory processes that allow for better methodologies for creation of health technologies and campaigns for dissemination and use of these innovative technologies. International collaboration has also been boosted greatly with the pandemic. The relevance of it, of international cooperation for access, for improvement of health, for strengthening the country's capabilities in terms of research and development. Another area is this strengthening of telemedicine with the consequent strengthening of adherence of patients to simplify and facilitate access, particularly to timely care and diagnosis of the disease, and the reduction and optimization of costs for the healthcare systems in granting the care and in terms of ease of service to the patients and capacity of the healthcare centers. Another point is strengthening cooperation with patients' associations and continue to raise awareness about the importance of prevention as we improve investment in the development of devices and technologies for early diagnosis, with the great impact of early diagnosis in both the patient's expectations as well as the cost for healthcare systems. And to enclose, I would say that as we've seen, there are many areas where the industry in general and the pharmaceutical industry for research and development are driving positive impacts in the economy and in the quality of life of people. But also worth mentioning the importance of to continue to build and strengthen these areas that will allow the industry to continue to evolve, invest, and having an impact and generating value for all people in our countries. With this, I conclude my presentation. Thank you very much for your attention, and we hope this study will be of use to illustrate the industry's impact and to continue strengthening collaboration, investment, and practices that favorably impact the quality of life of people in our countries. And with this, Rafael, you have the floor to continue with the agenda for today. Great. Thank you very much, Mauricio, and thank you for all the information that you've shared with us. I think these are extremely relevant pieces of information for all the auditorium and the audience, and a great proof of the impact of the industry by the great things that we can achieve in the future also. As you well mentioned in your presentation, there are things of collaboration, patient support, other issues where we can use the experience and expertise of our panelists today. I believe that this is a great chance to delve into more details of what you presented during and during the panel talks we're going to have. And so with this, I would like to introduce our panelists for today. Before that, I want to remind you of the rules for questions. We will try to respond to all questions that are sent to us. You should do that through the chat function or Q&A function in Zoom. And apart from Mauricio, who will generously accompany us in the panel, we also have Ever Maria Ruiz, founder of Latin American Patients Academy. Maria, thank you. And Dr. Andreas Seiter, Global Lead, Private Sector, Health, Nutrition, and Population Global Practice of the World Bank. Andreas, thank you so much for joining us. And so without further ado, we will go into the panel now. As I told you, you can ask the questions through the chat. And to get started, I don't see Andreas. Okay, I see you now. So you have the first question.
It actually has to do with public-private partnerships. And I think we've seen an evolution with respect to public-private partnerships in the health sector in Latin America. COVID, I think, accelerated that. And so, wanted to ask you, Andreas, from your perspective, can we expect these types of approaches to continue beyond the pandemic? And are there some lessons learned from the work that you at the World Bank have been doing in building public-private partnerships that you'd like to share with us?
Yes, thank you, Rafa. And when we talk about public-private partnerships, there is the narrower definition of the PPP, which is kind of a co-investment between the public and the private sector. But I want to talk about a broader definition, which is basically any collaboration between public and private sector, in our case, for the benefit of universal health coverage. It's a topic that is very much growing in demand. I mean, most countries understand that you cannot actually be successful in achieving universal health coverage by the public sector alone. And though it's the issue is that in many countries, the public sector is not well equipped to actually partner with the private sector, although the private sector might be willing and ready to actually also make concessions. So we see this often that the government officials don't know even what to ask for. They don't have necessarily the laws in place and the regulations that enable them to properly collaborate with the private sector. And I think that might also be the case in some of the Latin American countries. I mean, I cannot speak to all the details, but when we're talking about the pharmaceutical regulation specifically, that we have been talking to governments about how to actually negotiate with the pharmaceutical industry about the access to more expensive medicines. We had a very interesting learning event yesterday. Unfortunately, there are no Latin American countries that have joined that, where we talked exactly about this issue. So how do you actually prepare for negotiations? What regulation do you need in place? What data do you need so that you can can assess, for example, how many breast cancer patients do you have in your country every year that fulfill these requirements in terms of their genetic expression and so on, so that certain treatments can work for them. Only then roughly what the budget impact is that you have from current treatment and that you could get with a new treatment. And then you have to basically, you can set the parameters for your negotiation. So that's an important area that we are trying to support in very practical ways by engaging with governments. We can talk to ministers of finance. They can encourage their Ministry of Health and their health insurance fund, just build up this capacity. And I think it's an area also where your industry can continue to provide support and provide some technical knowledge to your counterparts to just make them more competent as negotiators. And I think that can create also win-win solutions. Let me stop here.
Great. No, thanks, Andreas. And perhaps as a further comment to what you were highlighting, one of the things, and I appreciate, I think we've got something like 130 participants in the webinar today, and we'll have more people who have a chance to look at this on the YouTube recording. And we've had the opportunity at FIFARMA to work with Andreas in partnership with some of the work that the World Bank is supporting. And one of the things that I've come to realize that oftentimes there are sort of very excellent best practices, but sometimes people get a little bit, sort of paralyzed because they've seen a model that is very sophisticated somewhere. And the reality is that, we actually have different mechanisms that can help people who are perhaps less sophisticated in terms of their ability to interact with the private sector. And so you don't always have to go to the most complex, data intensive, administrative intensive model. There are other models that we can benefit from where you actually can start, sort of building a win-win momentum without necessarily having to create something that is very resource intensive. And Andreas and the team, I think, have done a great job with support of consultants like MSH and others in walking through with different governments, what are some of the areas in which you can have that public-private partnership come together. Voy a cambiar un segundito y en español, Eva María, gustazo en verte.
I'm going to switch now to Spanish once again. Eva Maria, it's a pleasure to see you. You're working hand in hand with the patient community in Latin America, and I would love to hear from your point of view what has been the impact that you've seen on that community with respect to the new things that are being brought into the region. Well, the first thing that we can look into, and talking about the pandemic, and first of all, thank you very much, Rafael. Thank you to all your team and AcuVIA for creating this Zoom meeting on the importance and the participation of the industry on different actions, settings, and driving the economy, and how we can build great synergies to work together. We've seen that, and it's worth highlighting, and how we have managed to work together with you, with other government actors, and with patients to find solutions in such complex times of crisis. The first thing we saw was patients were not able to easily reach hospitals for treatment, and they've mentioned the issue of breast cancer and arthritis. I've read the study, it's been great to look at, and it's important to have this discussion. So I think that we've seen some other reflections emerge, and we've seen how quickly we've managed to respond to the needs in these times of crisis. But this is not only a thing of the now, of the present. Is right now we need the refrigerators or cold chambers for the vaccines and to have proper storage. Yes, we've responded in providing, supplying the medications, in supporting healthcare professionals, in providing the correct information, accurate information, because we had the big problem of misinformation. And in science, particularly you guys who had the information firsthand, helped people feel a little bit more accompanied and supported. We were all in times of crisis, but I think we've all also felt that support. Something that I love is that these support programs of the industry to maintain or to better understand chronic diseases and maintain adherence to treatment and contributing to the improvement in managing the disease and improving the costs or reducing the costs for the system. Sometimes we fail to recognize this, but there's actual work being done in support programs that cause patients to understand things and to cost less money to the system. Another thing that I feel is important is with respect to vaccination. We've seen that, and the pandemic has been the best possible laboratory to look at this, the agility they've responded to this with, and how this has become an issue for the whole world, not only in the region, thanks to your work on innovation and development. Of course, this has been a collaboration not only from the industry, but from the government, academia, and the patient side to really make these answers happen and get there, and that we can achieve a solution to this great problem. We just had like a big overview, and we managed to see the importance not only of the creation of jobs or contribution to job creation or alternative economy or indirect effects and all the things that are set in motion thanks to the pharmaceutical industry, but we've also had the opportunity of educating the population in general on how we do clinical research. And there I'd like to highlight among the good things that we have, and I look at it from the patient's perspective, I work to strengthen their capacities, and I like it if they understand that there are opportunities that arise, particularly when you do clinical research. Our region is among the regions where it is very hard to do these kind of procedures and processes, but it does happen, and they happen well. And when they happen, we are giving opportunities to patients to be able to reach through innovation a better life quality and understand that there are chronic diseases that can be less complex, less complicated. thanks to the new therapies that are being developed. So I think there are many things worth highlighting, worth noting. There are many things that we need to continue learning. And I think that one of the things that we're in the learning process still is how to jointly collaborate together. We've learned that collaboration is important from all stakeholders. All the legs of the table are important to keep it up. And so I think that there's greater flexibility and openness to continue looking at the opportunities to keep building and improving health in the region. And this is not only for the decision makers' responsibility, it is under all our responsibilities, but because if we have a healthy environment, we will live happier, our life quality will improve, and therefore, of course, the development in our countries will be improved also. Thank you, Eva Maria. I love how you highlight collaboration. I believe it's about collaboration and training. I believe that your mission at the Academy is very consistent with that notion that we want all actors in the health sector to be present, but also for them to have sufficient training for their voice to be heard correctly. And we've seen that during the pandemic in the types of collaborations that, as you were telling us and Andreas was telling us, and I think it's a moment that is worth leveraging. Science has proven that we can make a difference through innovation and development, but also make a difference working together, always with the mission of achieving better patient outcomes. Andreas, I think you've raised your hand.
Yes, I did. I don't see any questions in the chat right now, so I just wanted to maybe ask a question myself, also to the IQVIA team. See, so what I'm missing a little bit in the chat is the question. So you bring out the positive impacts of the industry on the economy, on labor force, on the people that actually work for the industry. No? But I know that, you also have a lot of spending inefficiencies in the countries. You have judicialization of decision making in some places, no? Where basically the health system pays too high a price because there is no negotiated price in place in the country. No? We have, so yesterday we heard from someone who was a former pricing executive that many companies of, those that are represented here also, they already have global commitments to differential pricing, based on the GDP of the countries, which would benefit many of the countries in Latin America. There are solutions even for in-country differentiation of pricing that make medicines cheaper for for example, if you have a treatment center in an area in a low-income neighborhood, which is particularly focusing on the poorer patients. In some places, these people can get a lower price for an innovative medicine. And that is good examples that the industry globally has. And also in Latin America, I know this is happening in Brazil, for example. But it's not, I don't think it happens at the scale that it could happen. And so when you have a positive impact on the economy, on the other hand, every middle-class person who has to pay large bills for expensive medicines out of pocket is drifting further towards poverty. So that would be interesting also to look at and see, what are the secondary costs, and how far do you want to push this? The answer for me again is, where can we find the win-wins? Where can we actually increase efficiencies in the system, eliminate unnecessary spending, eliminate inadequate prescription? Yeah? All areas, I think, which we need to look at when we want to have a more global view of the impact of this industry. And a great interest to us, because we are the organization that is trying to fight poverty. So I just wanted to put this out a little bit, so to make it not look all too bright and shiny, and saying there are other sides as well that need to be discussed. Thank you.
Thank you, Andreas. I think that makes a lot of sense. I'm going to switch to Spanish to tell you more about it. En nuestros estudios en la región.
In our studies in the region, And this is one of the components that we have precisely identified as an area of opportunity to strengthen the area is regulatory schemes. And I've tried to emphasize with respect to more expedited procedures to guarantee access, but also these procedures have to do with the pricing control models. These are models that have also been evolving and gaining ground in the region, and in Colombia even, since it was launched around 8 years ago. It's been constantly evolving. Another topic where we've made big progress and we've been working on in the region is value-based health models to recognize those impacts of not only the medication in terms of the cost for the healthcare system, but as we were seeing in the conclusions to the study on the productivity and the quality of life, that in the end sort of end up balancing out the costs paid by healthcare systems by medications. And there, that includes the great challenge of creating innovative models, systems and models of financing, as you were mentioning, Andreas, in terms of the access for the poor sectors of the population, how to reach these populations through models that allow to gather the resources that in the long term, the economy will end up recovering because of the productivity or because of the lower cost of treatment or the lower cost and the good impact for families, both at an individual and financial level for the whole system, as for the whole health system. And I think that includes a challenge of modifying and generating these innovative schemes and systems. And additionally, Andreas, with respect to other challenges, it has to do with what Eva Maria was saying, as mentioned by Rafael also. In terms of training, I think it's fundamental to be able to promote these spaces for knowledge production to allow us to align ourselves under this practice that really help us make progress in this access and coverage elements that are so important. Following up on what you've just commented, Mauricio, and we have another question on the chat, which is respect to counterfeit medications. And do you have any comments on the impact that this can have on the patient and the economy? Well, as Violeta was mentioning, I think this is a very high impact area. This is a recurring problem in Latin countries, and it is something that we need regulatory efforts to improve the trust that affects not only the medications themselves, but also the side effects of these medications for the economy. And then there's also issues related to the economic impact. What could you say that of these illegal economies? Because of course they don't pay taxes, and they are not articulated around the health system, and they escape any controls of quality and any possibility of granting what impact will it have on people. So I think that is a very highly relevant area in terms of control and regulatory efforts. Fully agree. Pharmacovigilance is extremely important. Eva Maria, you have the floor. Yes, I had a comment with respect to the counterfeit drugs and the big problem we have in our region. Beyond counterfeit drugs, we have substandard drugs. I mean, they don't meet the standards, and that is a big problem that we have because our regulations, our revisions, and manufacturing practices are not being correctly reviewed. And in some of our countries, we don't have high pharmacovigilance that would allow for the credibility of medications. And the fact that many people don't believe in generics, for instance, why? Because we have substandard drugs. That increases the out-of-pocket expenditure because of the lack of credibility from users on the system. So I think we have a big work ahead, and this is also collaboration, and we need education, and we need training. And to copy the best things from the high pharmacovigilance countries where they don't allow substandard drugs to be circulating, and everything that there is available is of quality, and so there's no concern when we're given product A or generic B. Fully agree with you. I think that's one of the things where we're jointly working with some other patient associations through the industry and through work with multilateral groups such as the World Bank, and to maintain these high regulatory standards. Because in the end, what we want is to achieve proper outcomes. And of course, we won't achieve that with counterfeit drugs. We're starting to get some other questions through the chat. I just saw one that is for Andreas. I'm going to English, Andreas.
The question is, what do you think could be the role of the bank in the upcoming years to help advance regional capacities around, real world data, real world evidence platforms and regulation?
Yeah, so I mean, I wouldn't think necessarily that the bank is the lead actor in it, but I see we have at least some level of a work program currently, and some engagement in some countries where we have started with government and regulators to identify these areas that already have been mentioned for capacity building. And that would be, that's an area that goes more into the regulatory side. I think if the demand is there, I would guess that our team is interested in taking this up. We are doing regulatory work, but in other continents, regulatory capacity building. And then also, as we don't have the depth of the technical expertise, as you know, in particular, when you look at regulatory science and regulatory science applied to new medicines, it's a very fast-moving area. So what we usually do is that we either partner with a technical agency, that would be PAHO in your case, or also with leading universities on the continent, or think tanks that are active in this area. So I could imagine a kind of advisory package in this area if there's interest in collaborating on this between PhilPharma and maybe also the patient organizations and the World Bank. I would be open for discussions.
Great, no, thanks. And I think that, again, it goes back to something that I mentioned that has been mentioned a little bit earlier, which is the sophistication with which the systems are able to allocate resources, right? And so to the extent that you have more real world data, more real world evidence, those decision makers, those stakeholders that have to allocate resources are in a better position to make sure that those resources are being utilized in the way that is most effective. Tengo otra pregunta.
We have another question, perhaps more directed at Mauricio. Do you know whether there are some statistics of medications that don't meet the standards? Have you seen that in IQVIA? No, I was looking at the question. I don't truly recall us having any figures in that sense. Of course, there are many impacts, as I was just mentioning, but I don't really remember any specific current or recent studies or figures. No, I don't. Yeah, we've seen that, as I said at the beginning, from the pharmacovigilance standpoint. This is one of the things that happens, and a little bit more technical detail than the audience is interested in, but worth mentioning, which is that when there are substandard or counterfeit drugs, oftentimes regulatory authorities are in no condition to follow up on these claims or concerns, and so they go to the pharmaceutical companies that have nothing to do with the counterfeit drugs, but can help follow up because they have control systems and follow-up systems with the patient. So they voluntarily end up sort of correcting or addressing some of the poor outcomes that take place as a result of these counterfeit drugs or substandard drugs. And it is an interesting somewhat uncomfortable situation, because in the ends up being the pharmaceutical house that has a right product trying to correct what is going on in a country or in a community with the use of the non-adequate medication. I think, Eva Maria, you've probably seen examples of this in your work. Yes, in fact, in our pharmacovigilance and surveillance systems in countries, not all of them are that well implemented. And unfortunately, there's not enough infrastructure or personnel that can do the corresponding tracking or follow-up and respond to the processes or faults in the processes. And sometimes we fail to issue the warning signs. And so it is then left for those who have the original product or the industry itself to conduct its own pharmacovigilance process. What we have been trying to work on is that, to try to improve the government's capacity to have well-implemented pharmacovigilance systems so as to help us guarantee the quality of all products that we make and have a good traceability and monitoring system. As our systems are not that well interconnected, it's very hard for some of the final instances of the pharmacovigilance process to connect to the actual process. That is where we find quite a delay and errors in issuing the warning signs. So that is something we need to look at. We don't have figures on that precisely because of a shortfall of evidence and information, but it's, I think, a topic that we need to continue working on head on, and to continue putting this on the table as an important topic with respect to regulatory matters. And I'm going to now hand the floor to Andreas, but I want to comment something on pharmacovigilance quickly. When we talk about the use of resources in regulatory entities, there's areas of activities, particularly in small countries with smaller budgets, that some things that can be used or leveraged. So for instance, we use the concept of reliance in English, of relying on international standards of some of the larger regulatory agencies, ANVISA, Orphan Drug Administration, or European agencies, and sort of try to redirect resources instead of duplicating some of the efforts from those agencies. We can use them for extremely locally based issues. Andreas, you have the floor.
Yes, I wanted to also talk about this issue of falsified medicines. There was a question in the Q&A. I saw that how can a patient identify fake medicine? And the answer is, it's not easy. Sometimes the fakes are bad, so that there's a typo on the package insert or on the package itself, or you can see that the quality of the medicine is not good. It's it doesn't look nice like an original package, but in many cases you cannot identify, not even the doctor can identify, or the pharmacist, without actually testing the medicine. So I think the solution is more, and Eva Maria, you just mentioned traceability. So that's something that we are hoping that we can promote over the next years, and having here basically Pharma in this meeting. So you as an association, you can also push for track and trace standards. The European Union, I think, is doing that. I think Turkey is doing that. And we are developing, I'm part of a steering group for COVID vaccine verification and traceability system that is meant to also in the future, it's something that you can build on and you can apply to other medicines as well. So if you're interested, I can connect you to that. I mean, it's going to be a long-term investment. It requires serialization of the products that you're doing, or at least some sort of recognizable barcode, and some investments at the country level. Because if you create a supply chain where the patient can trust that the pharmacy where they get the medicine is part of that track and trace system and has verified that the product that they have on the shelf is the real product, then at least you can avoid, you don't buy it in the street market, you go to this place and you have an original product. So that is my answer to this question.
Yeah, no, that makes sense, and that is in keeping with a project that we have at Pharma called Vigilantia that talks about some of these issues, and so I appreciate that. I wanted to go to another question on the chat. Mauricio, esta pregunta era para ti, la tengo que encontrar.
Mauricio, this question was for you. When will we be able to have more data on 2020, 2021? Because much of the information is from 2019, which is before the pandemic. Well, Rafael, as I told you in the presentation, the information that we use comes from different sources, IQVIA and our own sources. We have updated information. Our most recent information is from 1 month back with respect to the different markets. However, much of the information that you saw in the study is coming from sources such as the World Bank, the statistics departments of each of the countries, and each of these countries usually post information on a biannual basis. And it is very likely that information from 2020 will be issued mid-2021. So we're always on the lookout for any updates to this information so that we can incorporate it into the most recent data or the most updated data for our study. So what we could expect is for the updated information for 2020 should be generated during this 6 months after June 2021. Thank you, Mauricio. And within the context of your study, and let's go back to the information that you shared with us, I think one of the major concerns arising from this conversation is how can we start shifting the perspective? And a part of what you have shown from your study is that in many senses, health is an investment, it's not necessarily a cost. Perhaps that question could go to Andreas.
To invest more in health after the economic crisis, but how do we also make sure that key stakeholders see healthcare as an investment and perhaps more than just a cost line item?
Yeah, I think you need to show the data and the trade-offs. No? I mean, that's what health technology assessment is about, and economic impact assessment. So, I mean, there's when I look at from the Minister of Finance perspective, that's kind of our main counterpart in the country. There's many things when you sit down with them where they want to invest. Yeah, infrastructure, big thing here in the US these days. Yeah, build roads, build bridges, build broadband. That is investment into economy. That creates jobs, connects remote communities better with the market. So there's competing things to invest in. And I think within the broader societal dialogue, you have to position health and these parts of health investment, which are no-brainers. No? So anything that goes, for example, vaccines is a no-brainer because the cost benefit of a vaccine is huge. No? Then I think investing into eliminating waste, telemedicine can, if done right, can be very cost effective and can eliminate costs that are, created by unnecessary travel. It can improve the quality by connecting people immediately with the more competent part of the medical system. So that's, I think, in that context, that's a discussion that has to happen. No?
Great, thanks. And y eso me lleva a una de las preguntas que está aquí en el chat.
Thanks. And that leads me to one other question in the chat. I will ask this for Mauricio and Maria. Rosa is asking, I would like to know the calculation of investment to reduce the gap on technology training, as well as the positive impact with respect to cost coverage and quality of care with the initiation of telemedicine or with the increase of use of telemedicine. With respect to telemedicine, I think we've realized that many things that can be worked out without need to get to the actual health center or hospital. And that has taught us that we need to be a little bit more aware. And it has reduced the number of ER visits or emergencies in hospitals. And this has brought or it has stopped this bottleneck that the health services used to have when trying to care for unnecessary emergencies because of lack of education and misinformation. There we need to work a lot on health literacy so that whenever someone wants to use telemedicine and the digital resources that we may make available for it, to understand how to use them, how they will work in their favor, and how they will also be working to benefit and improve the service capacity of systems. For me, these times where we've started using smartphones and patients have started to have these consultations, and at the beginning they didn't trust them, right? But this has taught us a lot, and we still see the gap and this digital gap and this technology gap that the question is referring to that we need to bridge still. We are facing a problem because there's a lack of digital literacy still, and that's a problem that we need to work out. And this is not only for the health sector to work out, but it's rather for all sectors, particularly for infrastructure in our different countries. We had the services available, but the population could not possibly access them. So that has been a problem that we've seen clearly. Many people had a smartphone but had no internet service. Some people didn't know how to use it. Some people didn't know how to log in. So we are still trying to understand. We're in this to and fro and taking a leap. We've made a lot of progress, but once again, we need to invest further in these topics. We need to further educate the population, the users, and the people who are providing healthcare services to be able to use these new technologies and new services and adapt them to the populations that they will be taken to. Unfortunately, we are using some of the services that are used in some of the countries the same as they are used in other countries. And in our countries, they need to be adapted to the context, to the culture, to the language, and to the customs and to other social determining factors that will make these services help reduce the collapse of the healthcare systems and actually help people not to have to mobilize or to commute, and then that will be for training better experts or to connect people to better experts or to people who are better trained to attend to their health problems. Great, Mauricio. Thank you, Eva Maria. We were recently sharing with our clients and audience from the health sector a webinar where we were discussing how COVID has changed these dynamics. And one of these fronts is telemedicine. With respect to some of the things that we've talked about, I would compliment Eva Maria that training is essential in terms of patient culture to try to take the knowledge and empowerment of these tools that the systems are offering, but also for the healthcare professionals, because digital interaction calls for different skills for the physician. I mean, it is not the same to achieve certain trust with in-person care than with virtual care. So there's a series of techniques that may help you reach your patient with the same quality of service or level of trust in the virtual setting. So so it's how do I complement telemedicine with home care so as to facilitate patient access? I mean, also taking the hospital to their home and to reduce the impacts related to the problems of crowded hospitals or having to mobilize the patient to the actual health center. And there are many technologies that allow for taking the actual service to the patient's home. And this has some very special outcomes in terms of health and recovery of the patient, but calls for very significant investments in our country. And Eva Maria, you were also mentioning that this is an effort that is not only for the health sector to make, and we have a big gap to bridge in terms of access, digital access for our population. We have not only seen that during the pandemic with topics related to health, but also with topics related to education. The gap that we have between access to technology for vulnerable populations, particularly these people that are in a situation of poverty and have to put forth and there has to be a very important effort from the public sector, but also from the private sector to try to improve these people's conditions. I feel we've forgotten about something that is important too, which is regulatory matters. And the fact that this cannot be achieved if there's not a proper regulatory framework that helps differentiate and help and supports both the suppliers and patients in understanding where data can be shared or not shared and how are they to be shared. Yes, and I believe that the pandemic has also served as catalyst. There used to be a disconnect between the reality and what regulations stated when the pandemic started. And so the idea is to see how we can use this push that we've had to update regulations and make sure that we are doing just as we said with counterfeit drugs. We want to make the best use of resources, but also have regulatory support to protect the patients, and that in the end ends up yielding good outcomes for all. I believe this is something I will keep the discussion on. And when we talk about the health sector, Mauricio, I think you very well mentioned the health sector is not only what we usually think, the Ministry of Health and the regulatory entities, the paying entities or hospitals, but it will also start including telecommunications companies, other service providers, to the extent that we achieve this digital transformation on the healthcare sector. Another question that we had pending from Andres Quintero, perhaps I would like to listen to all your perspectives, is another industry challenge is misinformation associated, particularly with the anti-vaccine discourse. How to fight that? I know that there are some strong opinions here. Perhaps Eva Maria, I will give you the floor first. Well, as caused by this problem, this pandemic of info, we've created a toolbox for patients to be able to identify and to also understand that we are in a world where we have some abundance of information and we need to be able to tell the good from the bad one. And there's a lot going on, but not all of that need to be taken into consideration, particularly for vaccination. On vaccination, we've had an impressive amount of misinformation, and unfortunately, the problem goes on. And there's a big percentage of the population, even in countries where there's a good level of education, that don't trust vaccines enough. And we need to continue working on that in order to understand where the information is coming from, try to find good sources of information, not relying on whatever Yahoo or internet states, because of course, internet is the best dictionary for many things, but for healthcare, it not always has the right answer. So always try to find the right answers from the right sources, listen to the news also from credible sources and certified information sources. And for us to know that if we were not under such a huge campaign for vaccination, I mean, we're not doing it out of madness. I mean, it cannot be that this country, I'm talking about the United States, but I mean, we want everyone to get vaccinated. Unfortunately, other countries don't have sufficient availability of vaccines because there's these gaps. But I think that we need to continue educating the population to listen to their authorities, and the authorities to provide the right information, science-based, evidence-based information, and not based on whatever is being said around and could cause problems to entire populations. Andreas, any thoughts?
Yes, I mean, not very conventional thoughts. I mean, the conventional things are the obvious ones, but I'm thinking, you know, everybody's glued to the TV, no, after work and so on. You could have something like a news show. I mean, for those that watch the US TV, you know that people like Trevor Noah and so on, they have a very, very high audience, but you need to also find the news shows that target the people who are not watching these same news shows that we as individuals might prefer. And then I would just see that you bring up the rumor of the day and you actually spell it out on TV, and you have maybe a panel where you have 2 or 3 people from different backgrounds discuss it and demystify it. So not the authority figure, not the professor, the scientist, because they don't have credibility with everybody. No? Just use some common sense people and you know, and take it a little bit. Don't make it too heavy, too scientific. Do it a little light. I understand that people fall for rumors. It's very difficult to trust the authorities today. They are not all doing good for us, and you know that governments. To some extent are in the hands of special interests of groups with big money. So if you're not one of the big money people and you're out there somewhere in the country, you have a reason to not trust everything that's coming from the authorities. So it's not, the mistrust is not irrational, although the specific rumors that are going around are irrational.
No, that's fair. Mauricio, any comments?
Rafael estaba pensando que
Rafael was thinking, just as in other areas of dissemination and information campaigns, I see a big challenge for governments and pharmaceutical industry of being more aggressive in this targeting of the audience, as Andreas was saying, and with respect to prevention campaigns also. We've seen much stronger campaigns, for instance, when combining alcohol and driving. We've seen very strong campaigns against tobacco use. And I think that here in prevention, with its impact and with our experiences, there's room to be more aggressive and to try to find communications campaigns that help counteract misinformation that is going around so badly. And as they were mentioning, is something that is very, very current and cross-cutting. So I believe that this is room for becoming a little bit more aggressive in reaching the population with proper information. Yes, I fully agree with you. We have Álvaro Maldonado, a good friend from IFIT, which is an Ecuadorian association. And in Ecuador, they did exactly what you're saying, Mauricio, and undertake a commitment from all stakeholders, not only industry, but political world, corporate world, and managed to raise these figures with respect to the percentage of the population that was vaccinated, because there was this commitment where they all came together. And I think that what Andreas was mentioning makes a lot of sense. So to have this conversation with those that agree, but that have it also with those that disagree, bring it into the table and be able to have this discussion. As always in these webinars, we're suddenly facing the fact that we only have 2 minutes. So I want to thank you all very much for your participation. I know that we didn't manage to answer all the questions, but if there are some impending questions that you want to deal with, we will be showing you a slide with the email address from the communications directors of FIFARMA, and you can send her an email and we'll be sure to take the question to our panelists. But anyway, thank you all so much for your participation. It is worth pointing out that this recording will be available in our YouTube channel in all 3 languages. You can see it in Spanish, English, and Portuguese. The FIFARMA website will also have the presentations that were shared today, the full study details, and relevant infographics of IQVIA's work. So thank you all very much for your participation. Very special greetings to Florencia Davo, our FIPHARMA chair, always very supportive, Mauricio, Eva, and Andreas. Thank you so much for your participation in panel. I think we've shared extremely interesting information. So before closing, I will hand you the floor. Yeah. Thank you, Rafael. I want to thank the panelists, a truly luxury panel. Thank you, Mauricio, for IQVIA's presentation. I want to recognize the Access and Innovation team for driving this greatly valuable initiative for all those that make part of the pharmaceutical industry and health industry. So thank you very much. As Rafael was saying, the information will be made available to all the people for us to be able to further discuss the topics. Thank you very much. Thank you all. Thus concludes this webinar. We'll keep in touch, and from FIPHARMA, we'll continue to create spaces for dialogue and discussion, all for sustainable healthcare systems and the best outcomes for our patients. Thank you very much.